Hi, I'm Crystal Lim.
This thing says I'm predisposed to type 2 diabetes. What should I do? I don't even eat sugary foods.
Well, at-home tests can vary, so don't worry. It doesn't mean that you have diabetes. It just is saying you're at risk for it and you might be predisposed to getting it later in life. There's two types of diabetes. There's type 1 diabetes and type 2 diabetes. Type 1 is an autoimmune disease where a person no longer produces insulin and you need an outside source of insulin to make your body function. And it's not usually associated with obesity. Type 2 diabetes is usually associated with obesity, and it usually happens over the age of 40. Not an autoimmune disease, and you can modify your diet and take oral medications to help with the diabetes. So for your case, I would say you need to go to your doctor. Your doctor can do a full comprehensive body exam, a physical, to make sure there's nothing else going on. I would suggest doing some labs, testing your fasting blood sugars and a hemoglobin A1C, which is going to check for high blood sugars over a long period of time, 3 to 5 months, and then also making sure your weight is under control, because that is one of the high risk factors for it. Also, your doctor is going to want to know a health history of you and your family. If your siblings or parents have type 2 diabetes, you're more likely to get that. And that the best thing you can do, you're already not eating sugary foods, so that's great. Stay away from anything processed, anything sugary. Try to eat stuff that's high in fiber, vegetables, fruits, lean meats, whole grains, and stay away from that sugary stuff. Exercise daily just to keep your body weight with a normal BMI. That's going to be some of the best things that you can do. And don't worry, because these genetic tests are not genetic destinies. They're just a risk assessment of what could happen. They're looking at genes, if there's any mutation to anything on the genes when they're running it. If you have a positive, it's just saying there's a risk for developing this disease. And if there is a negative, it doesn't necessarily mean that you're never going to get it, because there are some things like breast cancer and colon cancer that you could have no family history but still develop the disorder, because that lifestyle and environment goes into it. And also within the at-home genetic testing, not all of them are as reliable as others. So having a medical provider look into the test more and your body system is going to help give an overall better comprehensive look as to if you're more likely to develop diabetes later on in life.